Good afternoon, everybody. We're going to let everybody jump on for a minute since the webinar just started. Hope everybody's having a great day. Everybody's filing in. I'm going to go ahead and get started with this. Good afternoon. Welcome to the 2020 Harmony webinar series. My name is Christy Weeks, and I am the Digital Media Manager for Harmony Foundation. Today's presentation, School Mental Health Providers, another resource for addiction counselors and others, is presented by Linda Burdick. She's a school psychologist in King Carl, Colorado. For those of you, let's get my slideshow working here. For those of you who are new to Harmony, we are nestled on a 43-acre campus up in the Rocky Mountains, just outside of Estes Park. We are a residential rehab that offers comprehensive treatment for adults and their family members. We believe that long-term recovery from alcohol and other drugs is possible. With over 50 years of treating addiction, we have fostered a generation of long-term recovery who supports our clients and their families for a lifetime. Harmony staff at all levels of the organization work together to create a community of recovery support. We are a 70-bed residential treatment program, and we have an additional IOP program that just was released earlier this year. We do offer an evidence-based 12-step program that is gender responsive. If you would like to learn more about Harmony Foundation, we invite you to visit us at harmonyfoundationinc.com or contact our admissions staff at 866-686-7867. We do have several precautions and policies in place right now addressing the current COVID-19 pandemic. So if you have any questions about that, please feel free to reach out to myself or our Chief Marketing Officer, Gina Thorne, will be happy to answer any concerns you may have. You can get her at gthorne@harmonyfoundationinc.com. Few housekeeping a few housekeeping items that I wanted to talk to you about, that as we move through this presentation today, there are a few things to keep in mind. You will be receiving an email about an hour after the presentation. Please be sure to complete that evaluation. We appreciate the time you take to fill those out, and that helps us find topics that you may be interested in learning about later on in the year. In order to receive a CEU from NADAC, you must be actively engaged in the presentation for at least 45 minutes. We do use a system that tracks how long people are engaged in the program, so anything less than that, and we are not able to offer the CEU, but we can provide an attendance certificate if that's something that you desire. You will receive a certificate by end of day on Friday. If you don't receive it by then, please let me know, and you can reach me at cweeks@harmonyfoundationinc.com. And that slide says Friday, July 31st. Obviously, that is not the case. So if you'll give me to this Friday, I would appreciate it. I believe that is the 28th. We are so excited to have Linda with us today. Linda Burdick is a school psychologist, as I said, in King Carl, Colorado. She is a national certified school psychologist and licensed professional counselor, specializing in trauma-informed care and grief. Her first job involving addicts and their family was working for the University Counseling Center and Roadhouse Crisis Line at Colorado State University. With her master's degree, she worked as a social worker at a Girls Club of San Diego and the Family Service Center at Miramar Naval Air Station. Her first job after graduating was working with the Navajo in Gallup, New Mexico. Her introduction to Harmony Foundation came when obtaining her education specialist degree. She worked for the University of Colorado Addiction Research and Treatment Services. For self-care, Ms. Burdick is a volunteer genealogist, volunteer instructor for American Red Cross Save a Life community program. She knits lap robes for veterans and enjoys her two cats, and I apologize if I butcher the name, Coco and Callie. So we're very grateful for this. And at this point, I am going to turn it over to Linda. If you do have any questions, please put them in the chat box. I'll be monitoring that and answering them as we go, or we can wait to the end, depending on the quantity. Linda, it's all yours.
You may have to remind me here on the share.
I'm going to stop share.
Aha, got it.
And there you go. There we go.
And there it is. Okay. You would think after doing this in the schools for the last 3 months, I'd be an expert at this.
All the way over to from the beginning to your left. There you go.
Okay. Well, welcome everyone. I appreciate your joining us. And as Christy said, I'm more than willing to take questions as we go along. So National Association of School Psychologists is the organization. They're in Bethesda, Maryland. And they are the ones that license us as nationally certified school psychologists. They are our overall entity, like American Counseling Association, American Psychological Association. Every group has their entity, and ours is NAS. So when it comes to addictions, NAS says addiction can present a significant barrier to students' health and ability to learn and develop. Schools can play an important role in education, prevention, and intervention. Their motto is, our job is to get the students ready to learn and empower teachers to teach.
Linda, can I interrupt you for one moment?
Sure.
Will you go up to display settings and hit swap presenter? The middle tab up top there, display settings, and then it'll give us a full screen of your slide.
Display settings.
Go back to from beginning, hit the from beginning, there you go. And that's going to pop up here in a minute. And then at the top of that screen we were looking at, we lost you. Where'd it go?
I don't know. Okay, so from beginning.
Yes, please.
See
we
the
love
line
technology. Technology is awesome. There you go. Now
okay.
Go to display settings at the top of this
Got
screen,
it.
And then hit swap. There
Display
you go.
setting.
There you go.
Okay.
Now we're cooking. Thank you so much.
So why is it important? Why are we here today? And I said I do appreciate you all joining me. By the end of this PowerPoint presentation, you should be able to, and I'm just going to highlight the 4 because I can read for yourselves. Identify how to collaborate with school personnel and why it is necessary. The differences in laws between what we have in the education setting and what you have in the clinical setting. And I just listed some of them there. The difference between a school therapeutic intervention and private therapy sessions. And again, we are an untapped resource. In Colorado, we're really good about getting permission from the parents to provide wraparound services. So we work very closely with individual therapists, community organizations, residential treatment centers, wherever that child is, we're working with that organization. But that's not national necessarily. And then briefly at the end, I will touch on crisis prevention and intervention within the school setting because it is significantly different. So I just threw in here, just for our knowledge and information, and this goes back to why is it important, is the CDC high-risk adolescents in schools. So we are going to be probably the first one to know, and if not, we're going to know a lot more than they're going to share with anybody else about what's going on as far as drug use and abuse. It's amazing to me always what my students will tell me because it's confidential. They know I'm not going to tell their parent or anyone else unless they're threatening to hurt themselves or someone else. So I will frequently hear about the parties. 14% of high school students reported having used illicit or injection drugs, and 14% of students reported the non-prescription use of opiates. Having worked in the addiction treatment research services with CU, I think those are both low. Also working in a K-12, I'm working with high schoolers, I would say those are fairly low, but that may just be the average. And then the critical piece of this article is risk factors and protective factors. When working with families with kids, we are a component that frequently just don't think of. And I was guilty of it when I did clinical too. So family rejection of sexual orientation or gender identity, association with delinquent or substance using peers. And I said, again, we're going to know about that, and we're going to know who those peers are. Lack of school connectedness, and then low academic achievement or special education, and mental health issues. And in parentheses, in the school setting, if they have mental health issues and require special education, in Colorado, that is called social emotionally disturbed. Every state calls it something different. So you'll have to find out from your state Department of Education what they call it. Protective factors of school connectedness, family acceptance, association with sober rule-following peers, and we know who those people are too, and medium to high academic achievement. Now, one of the significant differences in dealing with schools is our stakeholders. So when I have a meeting, it's not just the client and me. It is all these other people are involved in that meeting too. And all these other people are working with that student. So I have more information as a mental health professional. Admin's going to have even more information than I do because they have access to information that I don't than these other people, but everyone's involved. And so I just thought you might like to know what kind of training and what kind of education they have, because it makes it a little bit easier to understand where they're coming from. So our classified staff, or paraprofessionals as we call them in Colorado, have no mental health training, and they only require to have a high school diploma. They may have more, and they may have mental health training, but that's the minimum requirement. Our licensed staff, which is our teachers and administration, have some training in mental health. They are given a crisis and prevention and intervention class and behavior management class. And they have anything from a bachelor's degree to a doctorate degree. The mental health professionals have, and I'll get into this in more detail in the next slide. So the people that work in the school system as a mental health professional have some training to substantial training. They may have a bachelor's degree all the way up to PsyD. Yes, I'll discuss that more in the next slide. Parents that we work with, maybe high school dropouts, all the way up to doctoral level. Students at age 14 must be involved in all plans that we make for their mental health and their academics. At age 16, they can seek help without parent permission. And that last one is why I frequently hear about the parties and the drug use, sometimes the abuse. I did have a student come to me after Christmas a couple years ago in tears. She'd been at a party and a person had died of overdose. Not at our school, not a student at our school, but that's the other thing too, is we will hear about what's happening at other schools with other students because they all mingle. And so at age 16, they can come to me, they can say, hey, I'm really struggling with this, I don't know what to do. And then we can talk about, do you have an outside therapist? Are your parents aware? And we can problem solve that whole scenario with them without having to call the parents and get permission. Prior to that, we need parent permission to see them for anything other than just a quick, hi, how are you? Outside providers, such as yourselves, again, range in education from bachelor's to doctorate level. And then advocates or attorneys. So we will have people that come with the parents to help explain or help them get their needs met. The current population we're seeing a lot of advocates for is the transgender. And they will have either anywhere from a high school to a law degree. Obviously, if they're attorneys, they have law degrees, but advocates education level also varies tremendously. Any questions before I go on, Miss Christie?
No, ma'am, it's looking good.
A school mental health providers, and I did the generic. Each state is going to call people different things, but these are the ones that are common nationally. So school psychologist, I have what's an EDS. It's a master's plus 90 hours, or they have a PhD or PsyD. And the biggest difference between those two is I did not do an internship with a clinical psychologist, and I did not do a dissertation. But in 20 years, I've never had a parent ask me what my master's thesis was on, so I didn't see the point in going for the doctorate and getting the dissertation. Again, I'm licensed through NASP with the national certificate. Your school psychs will be also licensed through your Department of Education because I'm in Colorado, I'm with CDE. And then if we choose to get the private practice license, the DOR, Department of Regulatory Agency license, EDS is going to be what, like I have, licensed professional counselor, and then the PsyD will be licensed psychologist. And again, that varies state to state. I've seen licensed mental clinical health counselor, it just varies, but basically we'll be at the master's level, and then the PsyDs will be at the psychologist level. So we cannot call ourselves psychologists unless we say we are a school psych because of that licensure in the private practice setting. And our motto is removing barriers for all students to be their best. So that's the other reason why we're a great resource for you all, because we work with everybody. They do not have to have a special education plan. They do not have to qualify for anything. Any student in that building is our responsibility for their mental health. School counselors or school social workers are the next group, and they are actually the largest group. You're more likely to work with one of them. They have a master's degree, and they are licensed through your Department of Education. If they have gotten a clinical license, it's going to be an LPC or licensed clinical social worker. Some of them just get the master's degree, go directly into schools, and don't get the clinical license. And as you can see, their viewpoint is different, which is good. So school social workers are connecting families, community resources. School counselors are helping all students graduate. The last group that we have in the school setting that you'll work with or might want to work with is the behavior analysts. They have a bachelor's degree. They have a certificate in working with students with autism. That is their specialty. So they have done a lot of training in applied behavior analysis. They're licensed to the Department of Education, and their motto is behavior is a form of communication. And so this group is very helpful when you can't reach students and they're just acting and not talking. Now in the school setting, we have all of those people. And in my particular school, I'm there 30 hours a week. The school counselor's there full-time because she's also part admin. We do not have a social worker, but we have access to the behavior analysts through the district if need be. I have worked in schools where we've had the social worker and school counselor. That's actually my preference because we do have different training and do have different points of view. And so it's wonderful we can all get together and talk about a family and a student. Okay, how do you get a hold of us? The main question here, or the main point here. So as I referred to earlier, parents must sign release of confidential information prior to your contacting anyone at the school. Everything in our life, and we'll get to those laws later, revolves around that piece of paper. We can't even tell you that a student is present at our school without it. Because under the CARE Act and under our major law, FERPA, which I'll get into later, its confidentiality is even higher than HIPAA. And so for us to be able to even say, yes, we have that student, you need to send to the school the release of information from the parent saying we have permission to talk to you. Now you can also do that via email to the school secretary. It does not have to be mailed or hand dropped. Once that is done, then we'd love to talk to you. Parent must invite you to all meetings because we don't have the funding to pay you. So the exception is you can choose to not bill and for free to meet with the individual educational plan or special education team, teachers, or anyone else, again, once that release of information is signed. And I strongly suggest, especially now in the age of remote learning, making an appointment with them because all of our schedules are different right now. Who you're going to talk to depends on what information you're after. So if you're wanting to know about grades, attendance, and behaviors in class, you want to talk to admin, the paraprofessional or teacher assistant, and teachers. If you're wanting to know about behavior records, including past suicide or threat assessments, that is admin. They're the only ones that have access to all of that for sure. Some districts will allow mental health to have access to it, some won't. Admin always does. The school nurse, if you're wanting to know about anything medical or medications that the child might be taking that could cause problems with your therapy with them or with the family. For instance, if you have a family, the child is diabetic, some addicts will have been known to steal insulin. So it'd be helpful for you to know, yes, the child's insulin-dependent diabetic. We have insulin at school. They also have some at home. So things along that line, or other medications, like if they're bipolar or schizophrenic. What are they on that could be accessed by a parent or guardian or another member of the family? School mental health. For us, you're going to want to talk to us about assessments that have been done, social, emotional, or self-determination goals, and progress towards those goals. So we don't do therapy, and we don't do diagnoses. I'm capable of doing it. I worked in the clinical setting, but in the school setting, that is not our focus. Remember, our focus is to remove the barriers so the child can be their best. So to do that, we have goals. Common goal that I have is to increase their sustained attention to complete a task from 2 minutes to 4 minutes independently without a reminder. And we'll get a little bit more into how we write our goals a little bit later too. Another one I might have is they will learn and apply 3 coping strategies, such as taking a deep breath, talking to a trusted adult, or writing in a journal, drawing, whatever their preference is. In the school, in the general education classroom, in 3 out of 4 instances, as evidenced by grades, time on task, etc. And then we monitor how are they doing with those goals. Okay, these are questions you may or may not think to ask depending on your experience with us and how much knowledge you have about school mental health. So what school mental health providers do you have is the first one, because I said, like, at my school, I'm it. I have the school counselor and there's me and that's it. Other schools that I've worked at in the past, we had school counselors, school social workers, school psychologists, and then the behavior analysts. So who's there? When are they there? And how often are they there? So I know, like in the state of Nevada and other states, the school psych's never there. They go to show up to do assessments. Florida, I think, is another one that does that, where psychs are only there. They hire social workers, which is awesome, but the social worker may only be there 2 or 3 days a week. So for you to best be able to work with us, or us to work with you, it's kind of important for you to know when we're there. Now, some schools, and where I am in Jeffco, at the high school level, they also have what's called a social emotional learning specialist. So that's why you just do a generic question of who are your mental health providers and are they full-time or part-time? And that person is there full-time. And they are either a school psych or a school social worker or a school counselor. Are they providing a universal evidence-based social skills or suicide prevention program? And that is going to vary state to state, district to district, school to school. In Jeffco, unfortunately, we have had 4 school shootings in an 11-mile radius, starting in '99 with my alma mater, Columbine, all the way up to STEM this past year. Because of that, we have extra funding. Because of the extra funding, we have all of the following programs. So Second Step is a program that is designed to teach those skills of suicide prevention and social skills. And it's called Second Step because the belief is the parent's the first step. Home's the first, school's second. And it goes kindergarten through 8th grade. Sources of Strength, you can look that up online, I think, is a suicide prevention program that is done 9th through 12th grade. In addition to that, we also have Why Try and Resiliency for Youth, and that is all ages. And those I know you can go to whytry.org, and I actually have the links for you at the end too. And then the last thing that is probably most important to you, to help you, for us to be able to help you, is what is your post-crisis plan? So this is above and beyond when we have a student returning from residential treatment center, or you're getting ready to send the child into a residential treatment center. Those are reintegration plans. This is above and beyond that. So this is, what are we as a school going to do to make sure that they have the support in school to be able to learn, and that the teachers are kept, their information is kept confidential. The teachers don't know that they've been in residential treatment center, and so that the teachers just go on and do what they would normally do and treat them as if they're any other child, and make that transition as smooth as possible for them. And then also, to me, the most important part of this is, how can we help you with either following up in 3 months, or I said we always know who the people that, who everyone is, or later with friends and families. And I said impacted by loss here, because when I was writing this, I was thinking about our student that was at the party where the child died of an overdose, but that child didn't go to our school. So that was a friend impacted by a loss. Other losses could be removal from the home, parent is in residential treatment center, parent is in jail. We get a lot, I do a lot of work with grandparents raising grandchildren for the last 2 of parents in either treatment or parent is in jail. And so how can we help you in following up down the road with them and supporting you as a clinician, you as a parent, you as an, even if you're the one that's with the addiction, what can we do to help you? And that's what the post-crisis plan is. There's actually, and the answer to that question is a lot. Ask for anything and we'll tell you. So legal and ethical. So as I said earlier, this is where things get to be different for us. So in the clinical setting, you're going to have to sign your HIPAA. You're going to get a treatment plan. Ethical's the same. Whether you're in a clinical setting or educational, we have the do no harm, remove the ego. It's about the person, it's not about us. And then do not work harder than the student. In our case, do not work harder than the client. In your case, in the case of a clinician. But ethics are the same. The biggest difference between the two is the laws. And I said, we do intervention plans, we do not do therapy. And I will explain each of these laws here on the next slide. HIPAA, I'm hoping everyone by now knows about. And it was in 1996. Prior to that, in 1974, FERPA went into place. And FERPA is the Family Educational Rights and Privacy Act. It is the one that says we have to have that release of information from the parent before we can tell you anything. It is designed to protect children, especially those that have been removed from the home, those that are in foster care, or other situations where child endangerment is a real possibility. That was the thought process behind this law. Now, parents can see anything in the child's records until either they graduate or turn 18, at which point all school records become the property of the student. And then need to know basis release of confidential information. So even though you're directly working with that family and working with that student, you're not an employee or contracted independent contractor with the district. So that's why we need that ROI. ADA changed our world in the school setting because all of a sudden you have Section 504. So prior to ADA, you had special education, general education, and the kids fit in one or the other group. ADA came in and said, wait a second, there's an in-between group here. And Section 504, Education for All, is the in-between. So these are people that have a disability that impacts a major life functioning, including learning, writing, communicating, memory, has a physical or mental, is how they phrase it, and requires accommodations, reasonable accommodations, in order to do their job. So this actually covers you as well during this COVID time and before and after. If there is an accommodation you need to do your job, this is where you would get that accommodation. Reasonable is the critical term here. We joke in the school system about parents coming in asking for champagne and we only have a beer budget. So you can ask for anything. We may not have the ability to give it because of funding, or we may not have the ability to give it because it's not in our realm to give. It's not our skill set. That's what Section 504 does. And so that changed how we see kids, because that is up to the general education teacher to make sure those accommodations are being given. Frequent ones that we run into is extra time. Well, technology has changed this world too. So Google Read to Write, or another speech to text program. Frequent breaks, so they don't have to sit for an entire 8 hours. They're allowed to get up and go someplace. And then the other thing that comes under 504 that impacts all of us is mental health support, and occupational therapists can provide support for that student for like handwriting or whatever they need to fine motor skills. But mental health can be provided through Section 504. If they're Medicaid likes us to put in medical necessity, but if we're not billing Medicaid, that does not need to exist. We'll just go ahead and help them out. So I have a student that is brilliant in all AP classes and has high anxiety. And when they get anxious, they shut down. So they are on a Section 504 plan. They get the accommodations of extra time, flexibility in their schedule. And then they also get support from me for the anxiety. ESSA is the one that keeps changing its name. It's now, as of 2015, Every Student Succeeds Act. Prior to that was the Elementary and Secondary Students Act. And in between there was the No Child Left Behind Act. It's all the same law. It's basically saying that regardless of all those Title VII protections in the way we do demographics, gender identity, sexual orientation, race, ethnicity, religion, that regardless of who that person is, that they should have access to equal education. So nobody, regardless of their zip code, so in Colorado, we don't have, I'm from the back east originally, we don't have barrios, we don't have ghettos, and we definitely don't have tenants like they do in New York. We do have very poor people though. And we have migrant workers, and we have a lot of illegal immigrants whose students are in our school system. I don't know how many languages we have spoken, not like we've had in other states. And then that's just on the Front Range. The rest of Colorado is rural, very small towns, like population 100. And so in our situation, we're looking at our poverty is rural-based. They don't have access to internet necessarily. So it's no different than when I worked inner city. It's just different population, but the results are the same. And so I was very happy with this law that we finally said, enough's enough. Regardless of your zip code, regardless of any of those identifying factors, every child should be able to have the best education available to them, going back to our remove barriers so every child can be their best. And then the last one is IDEA, Individuals with Disabilities Education Act. It's been around in one form or another since I was in kindergarten. So I'll date myself there, early 1970s. And the latest authorization was 2019. And in that authorization, it said minimum is no longer good enough. You have to do whatever is necessary for that child to have equal access to academics and social emotional resources. So for instance, I have a student on autism who is obsessed with planes. So I have to do whatever is within my power to do to make sure that he has friends and he is getting along with his peers and not driving them crazy with his obsession with planes. And so that's going to be different based on that's why the emphasis here is on individual. So some terms that we'll throw at you, and every job has them. Doesn't matter who you are, what you do, we all have our jargon that we love to throw out, and other people look at us like, what are you talking about? So in the school setting, IEP is Individual Educational Plan. SMART goals, specific, measurable, achievable, realistic, and timely. So I forgot when I was going through my goals earlier to say I also have to put in there over a 9-week period. So what's the time span? How I'm going to measure this? Can the student do it? Is it realistic? Is it very specific? Like I said, coping strategies such as, and then what's the time frame? And students with individual educational plans, we review those every year, and every 3 years we reevaluate them. 504, BIP is one thing that any child can have. They do not have to be on a 504 or on an IEP. Stands for Behavior Intervention Plan. Prior to the BIP is an FBA, Functional Behavior Analysis. And this is where we may be asking the parent for permission to talk to you because we want your input on that. What behaviors are you seeing? What do you think is behind them? Back to that, the behavior analyst and behavior is a form of communication. What happened prior to it? What happened afterwards? What's the reinforcing thing? What's the consequence? Health plan is created by a nurse and can include mental health minutes if medically necessary. This is for our students with like diabetes, epilepsy, things along that line. Safety plan is the follow-up to a suicide or threat assessment completed at the school, which allows the student to remain in school with specific supports. And that's going to be very individualized also. And again, the only person that's going to know about the safety plan is admin and mental health provider if they are included in that. But admin is going to be the one that can tell you, does this student have a safety plan? Because the rest of us may not be aware of it. So differences and similarities. The one similarity that clinical and educational settings have is assessment. We all do the same assessments. The only difference between clinical and educational is in clinical, you usually sign up, you say, I'm going to come to your office, I'll be there at 11 a.m., you give them the test, and off they go. In the educational setting, we are pulling that child for testing multiple days, and then we're also doing observations, and this could be something that could be helpful for you. We observe them across multiple settings and multiple times. So lunch, science class, recess, PE, I mean, whatever we make sure we cover their entire day and their entire week so we can see back to that behavior, functional behavior analysis, we can see where their strengths are and where they might need some support. Then the differences. So in the clinical setting, you're going to be doing intensive long-term therapeutic intervention. In the school setting, I'm doing brief, short-term, skill-based interventions. At most, I have 30 minutes outside of the classroom to work on those skills, and then 30 minutes in the classroom to remind them that we worked on those skills. This is why we love working with you for the next two reasons. You're year-round. We're only during school days. You can go in the home, we can't. Now, the difference with cost and free is really more up to your clients and your parents. And then records are kept by you or your organization that you work with. Whereas in the school setting, records are kept for 3 years at the school. So if you are contacting us for information and it's not a child we're currently working with, and I have had this happen, and because they're getting ready to go into or out of residential, I'll have to be like, 1 second, let me, right now I'm not allowed in the school building. I'll have to get you that information when I'm allowed back in school because I have 0 records on me. And that includes my testing records too. Now those are online, so I can usually look them up. But as far as behavior and other things along that line, those records are, all the hard copies are at school. And then after 3 years, or after the child graduates, or after they move to another school, those records go to the new school until they graduate, and then they become the property of that student. So a little bit more about interventions, not therapy. You know what therapy is. So interventions is brief. Our goal is to get the student back to class. Our focus is on teaching a skill, and it requires a teacher referral. If they are not having problems in their academics, then they are not getting mental health support at school. The progress is monitored by the teacher, not by the mental health provider. We don't need a diagnosis. And this is the part I love the most, which is why I went back to schools instead of clinical. Weekly and quarterly paperwork. Once a week, I check in with the teacher, say, hey, how are they doing on their goal? And then once every 9 weeks, when report cards go out, I send home paperwork to the parents saying, this is how they did on their goal the last 9 weeks. So a lot less paperwork. And the other nice thing about it is we're paid the same. If the student's absent, it doesn't matter. We still get paid the same. There's no cancellation policy. And again, it's free. So because of the last two, my salary is a half to a quarter in the school setting as to what I would make in the clinical setting. But to me, having I'm not on call, I don't have to answer emails or phone calls after 3:30, Monday through Thursday, because I'm part-time, I don't work Fridays. So I don't have to deal with anybody on the weekends. I mean, all those things that I had to do when I was in private practice that I don't have to do in the school setting, it's worth it for the pay cut to me. I still get health benefits, I still get everything else. But just be aware that you may get, like on mine, at the end there on the contact information, is that it may take 24 hours for us to respond to you because we're not on call. And a lot of us at 3:30, we take off the clinician hat and we go be human beings and do our own thing. And then at 7:30 the next morning, we put on the clinician hat again and go back to being a school mental health provider. So how can we help you best? Everything's based on parent permission, but this is one of the ways that we can help is if you're unable to do any of the assessments, if you're not a clinical psychologist yourself and you want assessments done, prior to your client spending lots of money going to a clinical psychologist to get the assessments for their students, send them to us because we'll do it for free. And in addition to doing the assessments for free, we're also going to provide that parent, guardian, and you with what interventions we've tried, like extra time, more reading instruction, whatever it is, when they were implemented, how they've made progress with those interventions, and how they're doing now academically and social emotionally. And the other thing too is we can help you advocate for the parent or guardian for that student before, during, and after residential treatment, whether it's the student that's in residential treatment or another family member. We can help you advocate for them. And we focus on, the other reason I left clinical, went to school, we focus on prevention versus reaction. So we do a lot of training. Resiliency is the current thing that we're working on with the COVID-19, anxiety, resiliency, a lot of preventive skill training. And then, as I said earlier, we have access to people that you may not know about that are being impacted by the addictions. We're not as threatening as a parent or to parents and students, especially your typically resistant population I referred to earlier. I used to work inner city, and my monolingual, non-English speaking parents and students, while we had some language issues and I sometimes would have to, we do signs and we do different things to get around that. But I wasn't threatening to them because I'm not a therapist. I'm a school psychologist, but I'm not a therapist. So, and in presenting ourselves to them, we present as, we're here to help you do better socially, emotionally, and academically. So that's a little bit less threatening than we're going to work on your addiction or we're going to work on your anxiety or whatever it is that we're working on in a clinical setting. So by breaking down that barrier and that resistance, then we can help you have a better relationship with them and get further with them. And then the one that we love the most is we reinforce what you're doing. So whatever you're doing in therapy, we will use the same language, we will use the same program, whatever it is that we can do, so that they're not just hearing it from you as a therapist, they're also hearing it from us in the school setting. And so they're getting it home, school, community, and hearing it multiple times, multiple ways, and that helps then with reinforcing that this isn't, I just go to my therapist, I talk about this, we do this. No, this is your entire life. So we're on finishing up here. Here are the resources that I referred to earlier. You can look up your own Department of Education. They're all going to have it. I just put here CDE because that's where I am. They have a section on mental health and the mental health providers and what we can do for you. The Center of Disease Control, I included the rest of that article in case you want to look up the rest of it. And then I do a lot of work because I specialize in trauma and grief with the National Child Traumatic Stress Network as one of my resources. And then of course my organization that I work for, NASP Online. You do not have to be a member of NASP. They have a lot of handouts for parents and educators and community members, and they have a lot of information. If you're not able to access it because it wants you to go on as a member, let me know or let your local school psychologist know, and they can go online and get that information for you. And then I put here the intervention programs that we use at my school. Interventioncentral.org, Why Try? Everyday Speech is actually a speech program, but the speech language pathologist and I both use that because right now it has all sorts of information on remote learning, the COVID virus, that is very useful in my helping the students that I work with and their families in remaining calm, cool, and collected through this whole scenario as much as anyone can be. And then the last one is a fun one. Class Dojo is a way for us to communicate with parents, and the kids earn points. It's a behavior management system that's a lot of fun for kindergartners through 4th grade. So in conclusion, Colorado Department of Education paraphrases our role as removing barriers in order for all students to achieve your best. So that's where I got that quote from earlier with CDE. Any questions?
All right, I'm going to give everybody a few seconds here to type in some questions. Thank you so much, Linda. That was great information. While everybody's kind of thinking about any questions, I just wanted to remind you that we do record all of our webinars. So if you are interested, please visit www.harmonyfoundationinc.com, go to the professionals tab and select our archived webinars. That's where you'll find this presentation. And I also wanted to ask Linda, I've had a couple of requests here for your cheat sheet slide, it came right before the difference. It came before differences and one similarity. And
Oh,
that one.
that one.
Yes. Is this the slide everybody was looking for? I'll give you a minute to type in for a second. I have asked for a couple of copies of that because it's such great information. So,
yeah, along that line, Christy, so my contact information is at the end, and at any time they can ask me, but none of this is copyrighted. This is all stuff that I've gathered. I referenced CDC and I gave you the thing, so they can share this with whomever they want to.
So,
or take screenshots or whatever they want to do.
So let me ask you this: would it be okay if they requested it from you?
Yes, that's fine.
The slideshow,
Yeah,
because this was an amazing amount of information. And considering I have kids in school, I didn't realize what I didn't know. So.
Well, that's why I said in the beginning about we're the unknown resource, even for parents of students that are gifted and talented and just your run-of-the-day average student.
Absolutely. So if you'll scroll right on back to your contact information, I will also include your contact information in the email with all the certificates. So if anybody is looking for additional questions to be answered, they certainly know where to find you. And it looks like everybody's good with questions. I am so grateful for you, Linda. This was, like I said, amazing, and I hope it was helpful for everybody who tuned in today. Stay tuned for information coming out about next month's webinar. That should be being released sometime the next week to 10 days. And I want to thank you again on behalf of Harmony Foundation.
You're welcome.
For tuning in. Yeah, absolutely.
Yeah.
Thanks for tuning in, and we'll talk to everybody next month.
And I just want to thank everyone for tuning in too. And again, share my information with whomever you want. If you have someone that you think would be interested in knowing about this that was unable to attend today, that's fine. So Have a wonderful week, everyone.
Perfect. Thanks, Linda. Thanks, everybody. Have a great month.